I'm Dr. Tara, and this is Hopeful Hints, a podcast where you'll receive quick, hopeful hints on all things women's health and infertility. Here, you will find education, inspiration, and most importantly, find peace and empowerment as you walk through the next steps in your healthcare journey. Welcome to Hopeful Hints. I'm your host, Dr. Tara, and if you are watching on YouTube, the background looks a little different. It's beautiful. It's actually the Airbnb I'm staying at. I packed my travel mic with because I'm currently, at the time of recording, April 11th of 2025, I am going through IVF again. And April, the last week of April, has always historically been Infertility Awareness Week, but I want to make it Infertility Awareness Month. Anybody else want to join me? Let's start talking about this topic more, especially let's do its due diligence and give it a month-long awareness. So all month long, I'm going to be talking about infertility topics. If you go back and look at my other recordings over the timeline of Hopeful Hints, you will find every April I typically do have infertility topics. In fact, I mostly talked about infertility at the beginning of this podcast, and now it's more women's health in general. So you'll find a bunch of topics. But today we are going to talk about men and male factor infertility because we don't talk about this enough. And it's 50% of the problem for infertility. They're quite literally 50% of the cause of infertility. And I see it in our clinic missed all the time. And I'm done with it. So we are going to talk about the rise in male factor infertility. We're going to talk about some causes, some solutions, some things you can implement. And we're going to just start talking about male factor infertility more and why it goes overlooked. So there's been some changes in data that actually show, in fact, there was a 2023 published study that showed that it was actually called the Human Reproduction Update, showing a 50% global drop in sperm counts over the last 50 years. Like, what? That's a lot. This isn't a small dip. This is almost a fertility crisis in the making. And there's so many things that go into it. So we're going to talk about some environmental factors because, let's be real, I think that's a huge culprit of fertility in general. There's endocrine disruptors, and if we don't believe in that, that's just crazy. Like, they are there. It is happening. But what it actually does, and we know this from research, is it interferes with testosterone production. We know sedentary lifestyles are on the rise and have been on the rise. And when that happens, it reduces testosterone. And in fact, it even increases estrogen. And what does that do? It impacts sperm. All of these things impact sperm. I always tell my male patients in our clinic, if you're not feeling well, and in fact, our first visit and intake is a general wellness exam on them, and we go head to toe, just like we do with our female patients, and we do a full intake. If you're tired and not feeling well, and you're crashing in the afternoon, and you're not sleeping well, and you're stressed, and your lifestyles aren't great, your sperm isn't going to be great. And I'm going to go on a small tangent right out of the gate right here, because we need to talk about it more too. If you are seeing a provider and you have anything wrong with your sperm, and they're telling you it's okay, we can fix it or override it, it's not okay. And I should get more specific. If it is a general practice provider, not a fertility provider, or someone who deals with infertility patients all day, every day, that is a red flag. I have had so many patients in our office where their internal med doctor, their PCP, even the OBGYN has allowed very big red flags in sperm to pass through. Round cells present. Oh, that's fine. That's fine. And they're doing IUIs. And at some point I have to sit back and be like, okay, at what point are you just trying to make money off patients? You don't understand. You're not up to date on male factor fertility. There's a lot of things that can be done to actually improve that. And the bigger red flag comes when that provider, who hasn't been to any day continuing education or conferences on fertility, is saying that those things are okay and to continue to move forward. And they aren't talking to that male about making changes in their lifestyle as well, or doing blood work on them and checking levels on them. Where's their testosterone levels at? Where's their insulin levels at?
Do they have chronic stress? Do they have elevated cortisol levels? Because we know that elevated cortisol levels can actually suppress the gonadotropin releasing hormones. And what that does is reduce sperm. So a lot goes into this. And I just truly am proud of my team at Simply You because we've really done the training and taken the time to look at this more. And I truly feel we've helped a lot of couples succeed in pregnancy naturally or through IUI because of addressing male factor. So the other thing that we've seen and along the lines of common causes is things like variceals. Those go missed. They've never had an ultrasound done. They're actually having pelvic pain, like men with pelvic pain. They've never had that further investigated. They have ejaculatory disorders. Like no one's ever had these conversations with men to talk about that and hold a safe space for them to talk about these things that could greatly be impacting their male factor fertility. We're talking about lifestyle things. Smoking, but vaping can also impact this as well. Excessive alcohol consumption, we talk about that, but there's a lot of nicotine use out there. These Zens and these other trending nicotine things are actually not great at all for sperm. We don't talk about things like marijuana in the vapes, and all of that can truly be impacting male factor fertility. It's not going to be an easy thing to decrease or drop this overnight, right? So we work with them to decrease and limit their use and just to really overall improve their lifestyle as a whole, which in turn will improve their sperm as a whole. Let's talk about testing. Gentlemen, I know it's not fun. I know it's not fun. Like, part of me has a little bit of sympathy for you, and the other part is like, but we, the female, go through so much more. So there's home kits nowadays. We use a lot of home kits. So number one, the minute you decide as a couple to take the next steps for fertility testing, he needs to be tested at that time too. We need to have a semen analysis done. And again, you can do these at home. There's a lot of great kits. You can do karyotyping at home nowadays, which is huge. There's advanced testing for like sperm DNA fragmentation that isn't being done at certain levels of care for patients that you can take into your hands and do at home. Again, hormones. Like men, we need to check your hormones too. And so really looking at prolactin levels, looking at elevated estrogen and estradiol levels, things that could be actually interfering with the sperm production and making those levels bad. Don't even get me started. I have a whole another podcast where I talk about total and free testosterone levels in men and how many of you are told your levels are normal, but yet they're not. So optimal levels. You're probably feeling the effect of that. We need to stop being so scared of testosterone in men. But again, I digress on that, but we need to really be doing a full workup on you. What's your cholesterol look like? What does your insulin look like? Things like that. So I'm going to talk about some very basic treatment options and very basic entry level things that you can do. CoQ10, 200 to 400 milligrams a day is typically what we recommend to our patients. We know it helps improve motility. It's antioxidative. Again, before I say any supplements, always talk to your healthcare provider before starting any new supplements. We know L-carnitine is great. It helps that mitochondrial level, that function of the sperm happen with motility and energy of the sperm. We love zinc. We love selenium. We love omega-3s. Then we move into a lot in our practice. There's actual hormone therapy that's safe for men to help as well. So there's Clomid or N-clomiphene we use a lot too to kind of bypass some of that side effect or estrogen impact that it can have. We also do some HCG injections that we can do. We talk about TRT. A lot of men were on it. They come off of it for fertility, or perhaps we have that initial conversation about TRT so that when they're done with treatment too, that's something they might want to look into. We really like to wait until after fertility treatments to do that. Then let's talk about surgery. A lot of times in our practice, we are the first that are finding situations where surgical intervention is needed or genetic conditions are found for the first time in our practice. No one's ever had this conversation with them. We try a couple things, it doesn't work. We move into genetic testing and we find that to be the issue too. The next step usually is IUI or IVF to override some of that as well. And really working with a clinic, I can, at the time of recording of this, say that Simply You Wellness is the only one in the region, in the Dakota region, using the highest technology for IUI for male factors specifically. So our sperm prep process is the only one that's being done that helps litigate some of that, helps offset some of that male factor piece and really increases the chance due to our sperm preparation. I want to take a little bit as we end here to talk about the mental load for men. Like, we get it, men. The infertility is not an easy thing to talk about. And you guys go through this whole journey different than us. So perhaps you're listening to this and you're like, yeah, what's the big deal? Like, it's not a big deal. Let's take the sperm test. Who cares? Perhaps you and your partner are on two different pages about this as well. And I just want to acknowledge that. In fact, right before I recorded this, my husband and I just got the phone. He's flying in later than me. And he was talking with one of his friends about how different going through infertility treatment's been, for him versus me. And I talk about that. I have a couple episodes where I actually address that and acknowledge that and give it permission. It's okay. Like, I can only lean into him so much before I turn to my infertility warriors and who are women who have been through this before. And I can really unload on them in a different way. Or before leaning into your mental health professional. And as women, we can't use our husband all the time to be the only emotional support through this all, because they quite literally are like, I swear, why are different than we are on this. But we do actually know and have research that supports that men often experience anxiety and depression as well when they are going through this. And they're also less likely to seek help, right? Because that's not what men do. They're the strong, tough ones when going through this. So I want to hold space and just acknowledge that for you as well, men, that there is a stigma around male factor infertility. There is a stigma around mental health. And you often internalize a lot of this because of being a man and that masculinity that goes along with that too. And I want to just say it's okay to let that down. I encourage open conversations, therapy, support groups. Lean into your male friends who've been through it before. I do have a group of men that have said they have done that before. They had these conversations at the local bar on a Friday at happy hour because they've all three have been through that. I just want to rip the walls down around the stigma of infertility. I want this to be a conversation at every happy hour, every day of the week. And we need to start talking about this more, because it's going to get you treatment faster. It's going to get you the desired outcome of starting your family faster if we start questioning the narrative and we start talking about this more and we open these doors to conversations and we start questioning providers who aren't ordering things like they should be and digging deeper into the root cause of your fertility or helping you navigate other options to improve your sperm outcome as well. So I want to remind you that this is a shared journey and just validating each other. And that does include you as the male as well, but just to continue to communicate as a couple and know that these are hard times and just lean into each other during this time, support each other in whatever way that might be for you as individuals. But please, 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 please see a professional who treats male factor, who takes it seriously. And it's not the internal med doctor saying, oh, yeah, those levels are fine. I've seen that lots of times. In fact, mine were that low and me and my wife got pregnant. That's a true story that happened in my office, and shame on that provider. You are internal med. You're not reproductive medicine. Please do not. And the levels were bad. They were not good. And this individual was not well. Like, we work on, and we need to work on as a healthcare provider, sperm is the direct outcome of that individual's health. And I'm certain, men, you want to feel good. You want to have a good night's sleep. You want to have good energy during the day. You want to look good, feel good. You want to be gaining muscle if you're working out, all of the things. So find a healthcare provider who takes it serious and takes male factor fertility serious, because we need to start having these conversations more. Thank you so much for listening. Stay tuned for a whole series on infertility this month.